This past year, as in previous years, Hotel Dieu Hospital has stayed on course in achieving its vision of becoming a leader in ambulatory healthcare in the Southeast region and beyond, thanks to the hard work of our physician staff and volunteers. You'll hear from a moment from our CEO, Dr. David Pecora, on some key strategic initiatives. But let me highlight for you several accomplishments this year that have contributed to our steady advance in providing excellence in outpatient care. In August of 2015, we introduced a new Mohs micrographic surgery program, one of only 13 in Canada, that provides patients the gold standard treatment for complex non-melanoma skin cancers. New and permanent funding from the Ministry of Health and Long-Term Care gave a big boost to our adult chronic pain program. For those that struggle with chronic pain, this will mean less wait time, more access to care, and more treatment options. You'll hear more about these exciting developments in our video links in this annual report. We also secured funding to add a surgical component to our bariatric assessment and treatment program. Soon we will be providing bariatric surgery here in Kingston, close to home, for patients who currently have to travel to Ottawa and Toronto for this surgery. Our culture of research continues to flourish, with the Research Institute supporting new collaboration, new clinical trials, and partnerships with industry. This summer, a new high-speed skeletal imaging lab will be built at Hotel Dieu Hospital, one of the few facilities in the world that measures the human skeleton in motion. It will be the future of treating musculoskeletal injuries. In 2015, we earned a gold-level workplace award from the Ministry of Health and Long-Term Care and the Ontario Hospital Association. The award acknowledged the high quality of care of our services to patients and families, and how our workplace excels at supporting staff professionally and personally. And after a 3-day site visit at Hotel Dieu in September, Accreditation Canada awarded Hotel Dieu Exemplary standing, its highest honor and evidence that Hotel Dieu goes above and beyond national standards for safety and quality health care. That award is no surprise, given the expertise and commitment demonstrated every day by our staff, physicians, and volunteers. I'm very proud of Hotel Dieu Hospital, the work we do in our community, and our shared dedication in living the Sisters' mission of compassion in our community. We continue to move from success to success, and I'm sure more will be coming in the future. I'd now like to turn it over to our CEO, Dr. David Pecora.
Every year, meeting the growing healthcare needs of patients in our city and region calls on us to be more creative and innovative in finding solutions to providing care for the patients in need. We've learned to do more with less every year, and it's become ingrained in the way we do our business at Hotel Dieu Hospital. In spite of those challenges that are going on year over year, we've managed again this year to be in balance financially and have a strong position heading into the next year. And we've done this while still being able to see even more patients and initiate new programs like chronic pain, dermatology, and a new program that's starting up in bariatric surgery. We're bringing that kind of initiative to a Southeast Lynn-wide process called Healthcare Tomorrow, the Hospital Services Project. It involves all 7 hospitals, the Lynn, CCAC, and Queen's University Faculty of Health Sciences, to look at creating innovative and more efficient ways of providing comprehensive and better integrated care for patients across our region, and to make the best use of our resources and facilities. We've already implemented some strategic integrations, such as laboratory services and information technology, and we look to build on this in the future. One great area of opportunity that we already have significant program experience in is management of the chronic, frail, and vulnerable populations in our region, especially those having multiple medical conditions or associated mental health and addictions problems. And we think that Healthcare Tomorrow is a great way to improve and better integrate those services across the LHIN. As well, during the past year, we've worked even more closely with our community partners, primary care and various community agencies, to help to develop and support our program and their programs and better integrate them for the provision of care, especially to patients with multiple medical conditions or complex and chronic diseases. Now in our third year, our patient advisors are even more involved with patient and family-centered care and have participated and facilitated a number of processes, advisory committees, strategic planning, search committees, and feedback on how we're doing in various programs. And this has added tremendous value to the services we offer here. We're truly grateful to our patient volunteers and indeed all of our volunteer staff who help improve the patient experience and the value that we're able to provide to the community. We've been very fortunate to benefit from the support of UHKF, University Hospitals Kingston Foundation. We've received a little over $2.5 million in support during the last year, and this has gone to provide vital support for facilities and equipment. Last October brought the launch of our most recent major fundraising drive at UHKF with a target of $65 million, most of which will go to the ongoing redevelopment projects at all three hospitals in Kingston, and certainly for support of the Phase 2 projects, of which we have several at Hotel Dieu Hospital. So in closing, I'd like to extend my sincere thanks to all of the staff, the volunteers, the professional services, everyone who makes Hotel Dieu such a special and caring place to work. We know that community members and patients and family, and especially our staff, really value the experience they have here at Hotel Dieu Hospital. And of course, it all trails back to the legacy and the mission of the sisters who founded this hospital and created the foundation for the success that it is today, it has been in the last year, and what we look forward to in the future.